So as an assessment option, it can be nice to do this with your hands. You can get a much better feel of what's going on here. But we can also use a belt, especially if the person's limb is a lot larger. Okay? So we'll do the hand method here first. And there's a couple different positions. Is this unplugged or something? Hey there. You guys killing me. I'm going to unplug your table in retaliation. Two wrong, think or right. Alright. So there's a couple methods that you can do to hold the leg. Right? The first one, just relax here. You can let the knee just dangle. Okay? And then we can get our hands as far up proximal femur as you can. And you're going to interlace your fingers together. And you want to get their knee resting right against your chest or your shoulder here. So it's sort of a blocking point. Okay? Hands proximal femur. And what I'm going to do, I can pull it in and then just lean back here to get a lateral distraction of the hip. Okay? So that can be one method to examine lateral distraction and how that feels for stiffness. And the other one is actually supporting this leg a little bit more. So you have to get your body up under here. And now you get a little bit better control in this position of the whole leg. Okay? Same thing, that lateral distraction. Okay? When you do this as a treatment option, or if somebody has a much larger limb, then using a belt can be very helpful. Okay? So with the belt, it's going to try to be as far up on the femur as you can get it, and then you can loop it back around you. You want to give a little bit of room to yourself, but not a ton. You want to be relatively close to them. Okay? And with this, what people were doing in the previous lab, they're putting the table up much too high. So you want the belt to be roughly parallel to the floor here, so that when you pull, it's a pure lateral distraction of the hip. Okay? So make sure that they're not too low when you're up here, or they're too high and the belt has an angle to it. Plus, when you add an angle to it, now you can feel the belt dig in at different portions. The more flush you make it and straight on, the less it's going to dig in. Okay? So now we can hold their leg up. You can block distal femur with your sternum, and you can use a towel here if this bothers you. Okay? And then you can stabilize around the iliac crest with your cranial hands. And all you're going to do here, so I already had you on some distraction. You're going to push your butt back here, and then you can add some extra pressure there. And see how they feel with that. Good. And see what kind of mobility you get. If it's too tender where the towel is, or where the belt is, roll up a little towel and put it along the length of the belt. Okay? Just to dissipate some of that pressure a little bit. All right? Any questions about those ones for now? Again, think of those. Remember, these are assessment techniques where you find your R1s and your R2s, and all of those treatment options can have grades 1, 2s, 3s, and 4s. Okay? So don't forget that. But let's practice some of the hands-on there, especially the lateral glide one can be a little challenging. All right, there's belts in the bucket there, and some around the room, I think. And then we got one here as well.